Hi, I'm Dr. Jeremy Steiner, founder of the Electroacupuncture Institute. In this training, I'm going to walk you through a powerful systemic approach to healing, including the Bob Beck blood electrification protocol, frequency-specific pain relief, and how to regulate immune and vascular function naturally. Stick around to the end because I've put together a free downloadable resource that you can start applying this immediately in practice.
This is a $1,000 flashlight. I'm not going to recommend it until I try it on myself and my patients. But I did try it and I was like, oh wow, this is a $1,000 flashlight. That's really great cost for something like this. Considering Dr. Tennant has a similar scalar device and you're looking at $8,000 to get going on that. But try the blood electric on yourself. I don't know, only if you have any disease process that hasn't been going away. If that's you, blood electric at home, go for the Bob Beck protocol. Now the caveat is, we said, we're giving energy to the immune system and the red blood cells, and the immune system can kick into action. The immune system is also heavily affected by sympathetic dominance versus parasympathetic dominance. It needs good parasympathetic tone to actually remove toxins, because when there's sympathetic neurotransmitters too much floating around in the blood, the white blood cells are in fight or flight mode. They're basically scared and trying to keep the patient alive. Once you get them into parasympathetic, they can get detox symptoms. So I recommend you start the blood electric at 15 minutes. Then, if there's no detox symptoms, increase to 30 minutes for your patients. At home, they keep doing it and working their way up to 2 hours. If they have detox symptoms, they don't do the blood electric again until the detox symptoms are gone. Then jump right back into it and keep trying to increase the time. Once you get to 2 hours with no detox symptoms, now you start adding in 20 minutes of the magnetic pulsar, where you do the lymph nodes under the arms, the groin lymph nodes, and any problem the patient has. Prostate cancer, put it for 10 minutes on the prostate. Breast cancer, put it for 10 minutes on the breast. Dental issues, put it for 10 minutes on the teeth. We will do Q&A, but I was realizing that I have a lot to teach you that I didn't go over yesterday. So let's press forward. That's the blood electric. It's no more difficult than what I just said. 4 hertz or 4.6 hertz and the other specs that I just told you about. Let's talk about the systemic pain and inflammation treatment. Bruce Pomerantz, the father of electroacupuncture analgesia, who figured out that opioids are stimulated with the right types of frequencies. We have an internal opioid factory here. It produces beta endorphin, which is a combo of 2 different opioids. And this is 18 to 33 times more powerful than morphine. Eat your heart out, medical doctors. And it's a whole lot healthier, too, because you're producing it. Your body's producing it. When you do this treatment, not only is it dumping the storage of beta endorphin into central circulation and central nervous system, but it's also ramping up the production of this molecule. And here's the coolest thing, too. It's from the same part of the brain, so not only do you get beta endorphins with this same treatment, but you also get ACTH, which is a precursor to the most powerful anti-inflammatory in the body, cortisol. So again, eat your heart out, medical doctors. You can't do what we can do. Bruce Pomerantz found that slow frequency below 5 hertz is the perfect frequency for this. And not only that, but it doesn't work if you go below 20 minutes. And it doesn't work if you go over 30 minutes, or the more amount of time that you do going over 30 minutes trying to produce beta endorphins, the less and less the effect. So 35 minutes is 5 minutes of decreasing beta endorphin. this is why, primarily we choose 20 minutes. This was later verified, that was Bruce Pomerantz, this was later verified by Dr. Craig, who did spinal bracketing, and then even later verified by Bob Beck, Dr. Bob Beck, my favorite guy, who created something called a brain tuner, and those full frequencies, remember, he's the guy that brought us the fact that when you're using higher voltage and you use 2 frequencies, you get thousands of frequencies, and then also verified that the body's a high Q circuit absorbing what it needs and blocking out what it doesn't need. So, yeah. Global analgesics, there's a bunch of points that can function as global analgesics. Large intestine 4, spleen 6, gallbladder 34, stomach 36, triple energizer 5, and PC 6. And it's controversial. Some sources say liver 3. But why do I choose large intestine 4 over all of those? It's because its relationship to the thalamus, and we said whenever there's pain, one of your 4 needles should be large intestine 4 or thalamus. Whenever there's an immune system deficiency, one of your 4 needles can be the blood electric. Now I just took away 50% of the stress of your mental capacity when you go to work tomorrow. Isn't that cool? What's that worth? Now, when you're treating hundreds of patients, you don't have to think so hard about 2 needles, right? You could do 2 needle bracket and 2 needle one of these treatments, which I'm showing you. One thing you'll notice is it takes that 20 minutes to start the treatment. Then let's say you did the 20-minute treatment, low frequency, Li4, you turned off the machines. It takes 16 to 24 hours from then for your patient to feel the beta endorphins, because now we're talking chemical change. So that a lot of times your patient will feel better, their pain will be decreased getting off your table, but it's not from the beta endorphin effect.
Quick pause. If you want a simple framework for smarter point selection, download my free guide, The Early Point Advantage, below. And if this helps you, subscribe and share it with a colleague. Let's keep going.
It's from the fact that they're no longer in sympathetic dominance in that neural level or tissue. They're in parasympathetic and they're healing. And remember, sympathetic dominance is a pain signal, not healing, alarm. Cool. And I listed global analgesics here. Like I said, large intestine 4 or ear thalamus is my favorite. I'll show you that later today in my second session of the day. And then this third treatment, systemic autonomic nervous system leak or blockage. This is that triple energizer 5 and or PC6 treatment. Triple energizer 5 is, let me see if I remember this, is in German auricular medicine the greatest anti-inflammatory point for rheumatic disorders or autoimmune disorders. But also, somebody asked a question, in German auricular, they say treat triple energizer 5 last. Why is that? Because it can mess with your diagnosis. If you start treatment at triple energizer 5, that's going to get rid of, on the ear, for example, the deficiencies that we're looking for with the machine. Which is why I say first comes diagnosis. Once you have diagnosis, then you can do the treatment. And if you want, you can do triple energizer 5 as the last point that you start stimulation on, so that if you're using a point to select, like I'll show you later on the ear, the deficiencies are showing up before you erase them with triple energizer 5 and PC6. Now, this will balance the autonomic nervous system, and it will remove blockages to healing and temporarily remove blockages to healing in everything except the fire channels, triple energizer, and PC6 and autonomic nervous system. It can remove those type of blockages more permanently. Cool. So there's 3 treatments I just went through. Get your questions in the chat box for the Q&A at the end of this. Can I get a time check? The clock's not working. 10:21. Okay, gotcha. I just consulted the calendar in my head, or schedule. Okay, regulating blood flow to an area. This is called sympathetic vascular regulation. This will increase blood flow to an area or decrease blood flow to an area, depending upon what the body needs. If a patient comes in, they just smashed or twisted their ankle, it's all red, swollen, inflamed, and you do this treatment, T10 through L2, spinal bracket, for 8 to 12 minutes only, super important, it's going to decrease the inflammation in the ankle. Whereas 89-year-old Mrs. Smith comes in with osteoarthritis, not enough circulation, cold knee, the same treatment, T10 through L2, 8 to 12 minutes, now will increase blood flow going to that knee because it's working on the vessels, either increasing or decreasing blood flow. Who wants this treatment? I want a demo. Anybody? You want? Come on up. Can we get a microphone also, please? Hi, I'm Jeremy.
Sheridan Spencer.
Nice to meet you. So you want some acupuncture today?
I would love that.
Okay.
Yeah.
If we had a magic wand, oh yeah. If we had a magic wand and can fix any one problem today, what would it be?
Right knee.
Right knee.
Right knee.
Perfect. I'll pay you later.
Perfect.
How long you had right knee?
Let's say spring, summer last year, had meniscal tear clipping in September, and
Okay. So about a year ago it started?
now it's a whole lot worse.
Okay.
Yeah.
So a couple things just from the brief intro. What category is she? Category 1, Category 2, or Category 3? 3. If you're like, well, how do we know that? Do you have wisdom teeth extracted?
Yes.
She has wisdom tooth extracted. That's a Category 3 right there. Even if she never told us about her knee lasting over 6 weeks and not going away. Have you been doing any treatments or like physical therapy or anything? Yeah. So she's been doing treatments and it's still not going away, which leads us to which of the 3 treatments, well, you could answer this correctly for any of them, but immune system, right? Blood electric for her. Is it painful? Pain. What point do I want for that? Thalamus. Bam. We have 2 out of the 4 points selected, right? Now, go ahead and give me a diagnosis for her knee.
L3, L4.
Thank you. So he screamed out L3, L4. Why? You could consult the dermatome chart for a while, but you'll memorize these levels after a while. The dermatomes go to the knee that are L3-ish, L3, L4.
All right, that's the framework. If this training helped you think differently about immune activation, frequency selection, and systemic regulation, make sure you download the Early Point Advantage Guide below. If you're serious about mastering electroacupuncture, subscribe, follow, and share this with another practitioner who wants better results. Thanks for being here, and I'll see you in the next training.